This is LASOS, that's LA Strategies or Solutions. This is a program by the Institute for Public Strategies, the West Hollywood Project.
Meth use is a concern because we know from local data that meth use is increasing in LA County, and the complications associated with meth use, specifically mental illness, overdose, are also increasing in LA County. And so we are really galvanized around this issue and want to make sure that we have the tools in place, both from prevention as well as treatment, to address and mitigate this issue. A growing number of individuals are using both methamphetamine and opioids, specifically fentanyl, which is highly lethal. And many people are unaware when they're using meth, that it may be laced with fentanyl. It's hard to identify a singular cause of increasing meth use in LA County. We do know, and this is consistent with national data, that there is overlap between untreated mental illness, particularly serious mental illness, and methamphetamine use. We also know that co-occurrence of meth use with other substances such as opioids is common. And in addition to these, there are other larger societal determinants of drug use and meth use. A prominent one, which is talked about often, is homelessness. And we do see significant meth use amongst persons experiencing homelessness. Homelessness can be both a cause of meth use as well as a driver of meth use. And so it's not uncommon, for example, for methamphetamine use to start after somebody becomes unsheltered, in part because of the stressors, but also as an adaptive mechanism. So it's reasonable to question whether homelessness rates are also driving methamphetamine use, because homelessness rates in LA County are also increasing. So all this to illustrate that meth use is often related or intersects with other community health and social factors as well. We have treatment resources in LA County, and we think that not enough people who use meth and struggle with meth addiction access these treatment resources. And so we're working very hard as a public health entity, substance abuse prevention and control, as well as with our community partners, to raise awareness that treatment is available, that it works, that for individuals who are on public insurance, they can get treatment if they qualify and get it at no cost. And so for people who are struggling with meth use, we encourage them to access our services and be linked to treatment, because treatment is available, treatment is accessible, and unfortunately is underutilized for reasons that we are working to address. I think for a family member, for a loved one who knows or cares for somebody who's struggling with meth use, there are several things that they can do. One, I think, first and foremost, is to educate themselves on what addiction is, that addiction is a chronic, relapsing, remitting brain condition, and not a personal moral failing. I think that this acceptance is not only therapeutic for both the person trying to help the person struggling with addiction, but also for the person struggling with addiction themselves. I think it creates an environment of trust, an environment of acceptance that can go a long way in terms of moving them in their path to recovery. The other way a family member can help is by letting them know that treatment is available and that it works. People can come back from meth addiction, and our website, methfreelacounty.org, has more information. Our substance abuse service helpline is open 24 hours a day, 7 days a week, and provides support for people who are interested in being connected to treatment. And that number is 1-844-804-7500. I'm sympathetic to anyone and everyone who cares about somebody who struggles with addiction, because I think it takes patience. I think it takes acceptance. I think it takes a mindfulness of oneself to know what you are capable of and where your limitations are, and loving somebody in spite of the fact that they are hurting themselves and hurting you. So I think that there is significant internal work that can and needs to be done. There are support groups for family members who struggle, who have addiction in their family. Al-Anon is a well-known one, and this information can be found on our website, methfreelacounty.org, or just through a casual search on the internet. But I encourage people to really find support, and there is support of family members, caregivers, loved ones of people struggling with addiction, because without that type of support, it's really hard and very easy, I think, to give up on a loved one.
Thank you for watching LASOS, that's LA Strategies or Solutions by the Institute for Public Strategy's West Hollywood Project. Join us on social, Facebook, and Instagram.